Elsewhere, police and other first responders across the state are getting special training to better protect and assist the autistic. As Desiree Taylor reports, the goal is to enhance awareness and sensitivity, which advocates say is sorely needed in a state with the highest autism rate in the nation.
The rate of autism in the state of New Jersey today, children being born in the hospital right up the road from here, 1 out of every 94 children born today has autism.
Those numbers are among the reasons why the state requires first responders to receive training in autism and other developmental disabilities. So far, 10,000 first responders have completed a course offered through a nonprofit called POAC, or Parents of Autistic Children. Officers who took the class today at the North Ward's new Center for Autism will soon join their ranks.
The autism awareness training for first responders will provide the skills and knowledge necessary to recognize and appropriately deal with these encounters.
These encounters can sometimes be life-threatening, says this parent.
Sometimes children or adults with autism, if somebody approaches them and they don't approach them correctly, they can scare them and startle them. And while you think of a first responder as a person to help and to calm a situation, sometimes they can create chaos and make a situation even more stressful.
A state law mandates first responders complete an online course. This class isn't required and is considered supplemental, but New Jersey's Health and Senior Services Commissioner says it's beneficial.
Training like Michelle and even the Department of Health have put together will help our first responders to take that time to assess, to be able to communicate with these patients, with our people, with our children, with our young adults, and really do the right thing when it comes to intervening.
Early intervention is key, so is tracking this broad-spectrum neurological disorder. So far, 3,500 patients are now part of a state registry. Advocates hope this will demonstrate the need for more services and programs. Along with the training provided for first responders, the Center for Autism also offers an adult medical daycare program, and soon other programs will be offered for children and adults with autism and developmental delays.
The numbers are astounding of people who are being diagnosed. But the real epidemic and the real crisis here is the lack of services that are provided in the urban community. And that's why the Center for Autism is here.
And Adobato says the next goal is to create New Jersey's first charter school for people with autism. Desiree Taylor, NJN News, Newark.